Hello everybody, this is TJ and I'm going to present Foley Insertion. So I'm going to start by following my general principles and safety practices. I'm going to check the order, make sure this is the right patient that needs a Foley inserted. I'm also going to check the chart for allergies. I didn't note any shellfish, iodine, or latex allergies. And I'll also ask the patient just to double check. While entering the room, I'm going to gather my supplies and perform hand hygiene. I've got my supplies on the bedside table. I'm gonna ask the patient if those allergies are, if she doesn't have any issues with those allergies. I'm gonna also ask the patient if she has any mobility impairment. If she doesn't, she can do the dorsal recumbent position without any issues. I'm gonna use 2 patient identifiers before I get started. And I'm gonna start off with some peri-care, and I'm gonna grab assistance if need be. Okay, so I'm gonna go ahead, perform my hand hygiene. I'm gonna go ahead and expose the area. I'm gonna place a Chuck's pad underneath the patient while performing peri-care. I'm gonna bend the knees and have her spread out for me. Bend her knees and just relax her legs and put her in a dorsal recumbent position. I'm going to perform my hand hygiene. I'm going to don gloves. Got my warm soapy water with my washcloth. And I'm going to perform peri-care. Alright, got my warm soapy washcloth. So I'm going to go in, I'm going to spread the labia. I'm going to go on one side of the vagina, flip over to a different side of the washcloth, go on the other side, flip to a new side, go down the middle, and then I'm going to flip to the last side of the washcloth, and I'm going to go ahead and dry her up. Okay, and I'm going to throw this in the dirty linens, and I'm going to doff these gloves. So I'm going to take this to the dirty linens, perform my hand hygiene, and now I'm going to set up my sterile field. So, I performed my hand hygiene, and now I'm going to open this up. Only touching 1-inch border of this. I'm gonna grab this and only touch the tip and let it fall out. Okay. So without crossing, I let that air out, fold out. I'm gonna perform my hand hygiene and put on my sterile gloves. Only touching 1-inch of the border. Just gonna kind of fan it out. Okay. Go ahead and put on my right glove first. Back up. And if my glove were to roll down my wrist, I would completely redo this step. So, got that one on. So I'm gonna go ahead and scoop this glove. Back up a little bit. Without pinching. I'm gonna scoop this glove. Okay. Without crossing my sterile field. Pull that up as far as I can. Go ahead and adjust this side. Okay. And I backed up so I wouldn't cross my sterile field there. So I'm gonna go ahead and organize my stuff here. Toss this. Okay. I'm gonna take this off and I'm gonna lubricate 2 inches of the tip of this catheter. lubricant. Okay, I've got my lubricant. I'm gonna tear it open and set the tip of the catheter 2 inches into the packet and let it sit there. Okay, I'll set those swabs right there. I'm gonna go ahead and attach my saline or my flush to my port. Okay, and now it's set up to insert. All I need to do is swab her with betadine. So I'm gonna go in, displace that labia, and get her cleaned up with these swabs. Okay. So I'm going around so I don't cross. I'm gonna go to the outer portion, and I'm gonna discard. Okay, and go back in. Okay. Go near me. Go on the side of the labia that's closest near me. Discard. And then I'm gonna go down the middle. This last swab will let go. Okay. So now I'm gonna take this swab, go down the middle of the vagina, and discard. Okay? So now, I still got the labia displaced. I'm gonna get my Foley here, get it out of the lube. So I lubricated 2 inches of this, and I'm gonna insert it until I get urine return. Insert another couple inches and then inflate the balloon. So I'm gonna go in here, okay? Keep going until I get urine return and I'm not bumping, okay? So I got urine return. I'm gonna advance a couple inches and I'm gonna stabilize the catheter and use my flush, use all of my 10 cc flush. Okay. Try to get this off one-handed. Okay. So now I can discard this, and now I can give a gentle pull to the Foley to make sure it's nice and secure. Got my stat lock placed. I'm gonna make sure this little port right here is not pressing down on the skin to where it can cause a skin break or skin irritation. So I'm gonna go ahead and stat lock it there, give plenty of slack. And I'm gonna make sure my tube is free of kinks, twists, and it is. I'm gonna go ahead and hang this bag below the bladder on a non-movable portion of the bed. If I wanted to get a urine sample, I got a specimen, a UA specimen on the bedside. I can get a urine specimen if I needed to, but anything after the first void or any urine gets through this, I can't get another one after that. To conclude the procedure, I would doff my gloves, clean up my mess, clean up this mess. So I clean this up. So we'll throw that all away. Take the chucks pad out, throw it away. Before I take the chucks pad out, if the patient's covered in betadine, I'll go ahead and clean that up if need be, get her nice and settled in. I'll take the chucks pad out, doff my gloves and perform hand hygiene. Go ahead and put her legs back down, assist her with that. We'll cover her back up, get her nice and comfortable. Got that catheter bag below her bladder on a non-movable part of the bed, and it won't interfere with any parts of the bed. I'm gonna see if the patient tolerated the procedure well, and she did. When I document, if I get urine output, I'm gonna document the characteristics of the urine, color, amount, consistency, maybe if there's any, stones in it, I could chart that. Make sure the patient is comfortable, lower the bed, place the call light within reach, clean up my mess, perform hand hygiene, and I'm going to report and record my Foley insertion and any output I may have gotten. Thank you.